Smoking and lung cancer are always related to each other, but those who are around smokers are also at risk, and this risk is not only to the lungs but also cardiovascular diseases risk is seen in them. So come, let's find out from our expert Dr. Professor Anitha Ramesh, HOD Department of Oncology at Saveetha Medical College and Hospital, Chennai, Senior Consultant, Apollo Speciality Hospital, and Kauvery HCG's Cancer Center. Welcome to the show, Dr. Anitha Ramesh.
Yes, hi, thank you for calling me.
Thank you, doctor. So my first question to you is, what is second-hand smoking or passive smoking?
Yeah, second-hand smoking or passive smoking is that when somebody is smoking the cigarette, okay, he or she will be exhaling after the smoke is over. Now, and the surrounding people, nearby neighbors, children, family, other members, they inhale that smoke. So that is called passive smoking. That smoke is equally bad, or it will be even worse than the smoking or the smoke of the tobacco. And though you think that you are not smoking, by inhaling this tobacco smoke, the similar quantity of the carcinogenic toxins you are inhaling inside it. This is called passive smoking, and it causes same type of carcinogenic effect inside the body like what lung cancer.
Doctor, how bad is second-hand smoking for children and adults?
Yeah, it is very, very bad, particularly for children. Not only cancer, you get the COPD, that is the chronic obstructive pulmonary disease where children keep coughing. You get restrictive, you get bronchitis, all the chronic lung problem, lung fibrosis, and all the most dangerous of which cancer also predisposes by taking this. So it's a big danger to mainly women and adults and children who stay near people who are smoking. They get injured in the lungs. Okay, chronic injury plus cancerous development by passive smoking.
Doctor, what is your message to society to protection from second-hand smoke?
Yes, it's a major global problem. It's a problem for all of us in the society. You know, tobacco is the killer, and it is an established carcinogen. So we need to eradicate tobacco. First of all, production needs to be banned at all levels, and then distribution and trading of tobacco to be banned. Tobacco needs to be banned at all public places and children to be kept away from it, and we have to increase the tax imposed of them, the cost, so that the consumption comes down. We have to avoid screening of movies and television serials which shows lot of intake of tobacco. And there is something called e-cigarette. It's rising just to remove the tobacco and get the effect of the nicotine. How much it is safe, we are not aware of it till, but then many of the youngsters are using the electronic cigarettes or the e-cigarette. So now, as on today, it's better to avoid that also. And if you are smoking, please better to go to a designated area to smoke, because you should not expose the bad second-hand smoke to the rest of society, who is also prone to lung cancer because of your smoke. So quit smoking. And another option is there, if you fail to quit smoking, and particularly in heavy smokers, it is better to go for a screening by low dose CT scan, which will help to pick up cancer at an early stage so that it is treated for us. Thank you.
Thank you for watching our show. Hope you find this useful. For more updates, subscribe to our channel, Studio Aureate.